There is certainly a need. And then
Welcome back. If you're a retina specialist, whether you're just getting started out or considering your own private practice or have an established practice, you're going to want to check out this next spot. We have Ken Fong with his tips on how to grow a successful retinal practice. Take it away.
Hey, Dr. Fong, welcome to the show.
Hi, Matt. Thank you for the kind invitation.
So we're sitting down with you today to talk about private practice. For all of you who missed it last year at our first CAKE PIE Expo, Dr. Fong hosted a roundtable symposium on building and growing your ophthalmology clinic with 3 other doctors with outstanding practices around the region. A lot of the attendees last year thought it was one of the highlights of the expo. A couple weeks ago, I actually got to visit Dr. Fong's practice and see the magic in action. There were lots of really cool things to see, especially now that COVID restrictions are being lifted worldwide. So I've got to ask, Ken, how's life in our post-pandemic world for you?
We're pretty much getting back to normal, but we're being a new normal whereby a lot of precautions are taken with every patient. All masks are still on between the doctors, staff, and patients. I think, as I mentioned in the symposium last year, a modern private practice should always have electronic medical record and HIS or information system. We should strive to go green, so reduce our reliance on paper, reduce our reliance on excessive wastage. And I think, as you saw when you visit our practice, we really are very focused on that aspect as well.
Well, it's been a challenging time for everyone for sure, and really nice to at least put COVID in the rearview mirror. So I'd like to move to a topic that I hear a lot of people asking about. There's quite a lot out there about managing refractive practices, but not a whole lot about practices strong in retinal treatments like yours in KL. So what do you think are some key differences between managing and growing private retina clinics and refractive ones?
Yeah, you're right. We do focus a bit more on retina because that's what we're good at. We're also very good at refractive. And I think one of the key things is accessibility and efficiency. So we have to be able to meet the patient's expectations by having available the doctors and the staff whenever they're able to attend. Intravitreal injections are a big part of any retinal practice. So we have a very good, what we call lane or SOP protocol for handling intravitreal patients. So they need to come in, register, have their OCT scans, see the doctor, and then go ahead and do the injection and move on. So all that should be done under an hour. Efficiency is very important for any retinal practice. On the other hand, a refractive practice is quite the opposite. These patients need a lot of time in counseling. They need to be explained to about the different pros and cons of any refractive procedure in them. And they often spend up to 3 hours in a clinic. So the time frame spent for retina and refractive patients is very different. Retina patients tend to be a bit older. They tend to be time sensitive. They tend to be quite urgent. So operating theatre availability is very important for them. Whereas refractive patients tend to be more selective about where they go. The ambience of the center is very important. The professionalism of the staff handling and counseling them is also very important.
Yeah, perfect. I think a lot of folks out there looking to launch a private retinal practice or even ones mixed with refractive surgery are going to find that helpful. Let's talk about one other challenge that all doctors have to deal with, which is patient education. What kind of role do you think patient education plays in the clinic?
As you can see, we do a lot of educational videos posted by our doctors and optometrists. These videos are carefully curated. Multimedia is so important, as you know yourself from your work in the industry. The videos should contain a lot of factual information to guide the patient towards a decision about what they want to do about their condition. We try and have our videos in many different languages. As you know, Malaysia is a diverse country, so we try and address all those factors whenever we communicate with our patients. And of course, social media survives on video. It survives on content. Patients are not satisfied with just a simple poster or text words in your social media post.
Well, given the importance of patient education, as you said, can you tell us a little bit more about the types of videos that you're creating and why?
In terms of videos, it's just short 2-minute clips about common conditions, explanations, myths about surgery, education about specific conditions like macular degeneration, diabetic retinopathy, common conditions, common but important to be educated on. We have a dedicated multimedia crew as well. So we're quite familiar with using all the different platforms for producing educational videos. And I can't say we are the best. I know we take a lot of examples from many other big private centers or even public centers around the world, and we learn from each other.
Great. So, recently we've been running a lot of pieces in the magazine and in our social media channels about the ophthalmology optometry crossover. Can you start by explaining how you work with optometrists in your practice?
Optometrists are really the front line in primary eye care in Malaysia. There's always an optometrist in your neighborhood in most of the major urban centers in Malaysia and also in the rural areas. So we engage them by having a lot of educational programs. During the COVID time, when we under lockdown, we had a lot of Zoom meetings with them. We had a big eye care symposium last year attended by more than 1,000 delegates online. And we're very happy with our level of engagement. Of course, feedback is important. Every time an optometrist refers a patient, it's important to feedback to them about the condition and what you've done with them. We also have a lot of face-to-face symposiums. We have small workshops on specific things like corneal topography, visual fields, ocular motility, and so on and so forth. We are also moving towards professional education of ophthalmologists. So we are running a Part 2 FRC op examination course in October for exam candidates sitting the professional exams. By providing that sort of educational service, I think we're able to help elevate the level of ophthalmology and optometry practice.
And let's talk a little bit about referrals, as it seems like that can be a key driver for growing a private retinal practice or refractive practice. What are some tips that you can give to those just starting out to kick up their referral network?
Referrals stems a lot from relationships. And I think there has to be a large level of trust between the person referring to the specific ophthalmologist. We have to be engaged in an open relationship, open communication. I don't believe in a referral practice that rewards financially people who refer you. I don't think it's helpful for both sides. And I think many optometrists also agree with that. As long as their patients mutually benefit, they get the best possible care, I think that's the most important. Similarly, when I refer patients to make their glasses after cataract surgery, I would want to know that they're going to the best possible optometrist or optician in their neighborhood, getting the best value for money.
I know Oasis Eye started up, I believe, just as the pandemic was happening, right? So what were the things or the key drivers of growth of your practice, would you say, despite the conditions?
It's word of mouth. It's the reputation of the doctors and the center that carries through in any private practice. If you run a private practice like a business, relying completely on marketing and people to promote you on TV or advertisements, I don't think it's going to survive very much. The doctors and the staff have to be extremely competent and provide a very good service to the patients. We were put on the insurance panelship of many major insurance companies within a very short space of time, which is a record in I think Malaysia in itself. But I think that shows the level of trust the insurance companies, the patients have in us to entrust their eyesight to us. So I think reputation is very important, and every patient that comes through your practice is essential. You have to treat them very well, and you'll find that they bring their friends and family after that.
All right, so I'm going to put you on the spot here with some quick tips. What are the top 3 things that you wish you knew when you were just starting out with your practice?
Don't be afraid. There's always a great fear when you start out in private about what's going to happen. I think focus on the present. Focus on the patient in front of you and doing the best for them. Number 2, I think, of course, believe in yourself. Quite often, doctors are very conservative people. They may prefer to be salaried by a specific group or hospital for the security. But I think we shouldn't be institutionalized. If you trust and believe in your capabilities, I believe anybody can do well in private practice. And number 3 is you wouldn't believe it, but when I joined private practice about more than 10 years ago, leaving an academic world, I thought I'll stop doing research, I'll stop doing teaching, but I'm doing that even more than ever. It's important to realize that even though you may be in private practice, but research and teaching still remains a very important part of our practice.
Well, Dr. Fong, thanks so much for joining us today. That's a lot of great info for our viewers. And it's such a critical topic for those retinal, refractive, cataract specialists who are looking to expand from the medical world to the business world. We really appreciate your insights. Really looking forward to talking to you the next time around.